My sister and I had such a close bond. She was very, very funny and very quick-witted, very caring as well, very thoughtful. Kathy had a mental capacity of about an 8 or 10-year-old. Found it quite hard to mix with other people. I felt like when my sister died, it was like I lost my own child rather than my sister.
Kathy was loved, but she had a family history of bowel cancer that should have meant regular tests. When she was finally taken to A&E in awful pain, it was too late. The cancer had taken over.
Her stomach was really distended. You could see that there was something wrong with her stomach. To be so advanced that she had to have a stent put into her tumour for her to be able to go to the toilet, because she obviously at that time, this tumour was blocking her bowel, so she couldn't go to the toilet. That's really advanced cancer. That's not something that just happens overnight.
But this didn't just happen to Kathy. Late diagnosis is killing people across the learning disabled community. And the latest report shows that cancer is going up as a cause of avoidable death.
She became agitated and frightened quite quickly by anything to do with doctors or hospital or anything like that, if it involved people touching her. But I think she would have done the bowel screening home kit. That wouldn't have caused her any anxiety. She would have quite happily have done that.
Families like Kathy's want to know why adults with a learning disability die on average at 62, nearly 20 years younger than the general population. Kathy was just 57.
Everyone from the care home was coming in to say goodbye to her. She did pass away really, really peacefully.
The annual Learning from Lives and Deaths, or LEADER report, investigates avoidable deaths of learning disabled and autistic people. And there's been virtually no improvement since the last report. These problems, accessing vital cancer screening in particular, are also affecting physically disabled people, even experienced equality campaigners.
Thank you so much, Sue, and hi everybody.
Sam Renke is a well-known disability activist and actor. She's been educating health professionals about how they can do better.
Leave your egos at the door. We're all guilty of unconscious bias.
Recently presenting new research with the University of Sheffield into overcoming the barriers to cervical cancer screening.
You might not know what my needs are, you might not get it right even, but you're willing to have that conversation. You're willing to investigate, you're willing to meet my needs.
Because right now, needs aren't being met. And Sam knows all too well from her own bad experiences of internal medical examinations.
Although I am someone who has had over 200 broken bones, I would say that I'm pretty hardy. I do remember in that moment, I was the one that asked them to stop because the pain was so excruciating.
At St Christopher's, we have approximately 40 people with learning disabilities under us, and about 50% of those, or just over 50% of those, have a cancerous diagnosis, and a large proportion of those people were diagnosed late in their illness.
I know, I think that arm's getting very strong.
Angela is one of those people. She has a mild learning disability and is autistic. When she was finally taken to hospital, her breast cancer was so advanced, the tumour had burst through her skin.
Did you notice the smell about the wound as well? What was that like?
Horrible. Ugh, horrible.
It should never have got this bad. The early signs of fatal illness are falling through the gaps.
Friends and family are amazing and so supportive, but they're often not with that person all the time. People are often living in supported living or residential homes where, staff may be changing quite a lot. And they're often relying on kind of the healthcare professionals and those with them 24/7 to recognise the soft signs of people deteriorating.
Responding to the LEADER report today, the NHS Confederation acknowledged the need for better early monitoring, saying, "We must ensure all people with learning disabilities are offered and able to access annual health checks. Breast cancer screening across the board typically begins age 50 or thereabouts. And if, like Angela, you have a family history, it should start a lot earlier."
And this is a sad thing to talk about, but your mum died from breast cancer, didn't she?
Yeah.
Yeah, and you were young.
Yeah, 14.
Yeah, very sad. And did the doctor or did anybody ever talk to you about your family history or about screening for breast screening? Do you think if somebody explained to you about your risk of breast cancer, that you might have gone for screening?
Yeah, I did. I would have gone then.
You would. And if somebody sort of helped you to understand what screening was,
Yeah, it would have helped then.
made it less scary?
Yeah.
Because sometimes people find it really helpful to go and visit the screening unit before they go,
Yeah.
and to meet the person that will be doing it.
Mm.
Do you think something like that would have helped for you?
Yeah, like a mammogram and that.
Yeah, like a mammogram.
Yeah.
Angela was only recently told her cancer is terminal. She says she wants people to know her story, but she finds it very, very distressing.
I remember when Angela told me why she wanted to do this, she was saying that she wanted to help other people. Didn't you? I think you're amazing for doing that.
I think it's very hard. It's really sad when you know somebody's death or you know somebody's diagnosis could have been avoided.
What do you think is really important for people watching this to know?
You get free screening.
Go for your screening.
Get free screening.
Angela T, finishing our report there. Well, I put the question of avoidable deaths to Wes Streeting when I spoke to him earlier. This is what he said.
It's a shocking set of statistics that were published yesterday. It's why we're rolling out the Oliver McGowan training programme covering 3 million health and care workers to make sure that we've got the right training and understanding in place to prevent avoidable harm. Learning disabled people are entitled to an annual health check with their GP. The take-up is well below 100%. So there's a lot for us to do as a government in terms of improving provision, but also to raise awareness of the provision that's already there.